Good morning. In this video, I'll be discussing about oral glucose tolerance test. What is glucose tolerance means? It is the ability of the body to utilize an amount of given glucose over a time period. For example, suppose if I am taking some glucose orally, immediately after taking it, my blood glucose level will increase from the basal level. After some time, whatever I have taken extra, that will be utilized by our body and the blood level will come back to the basal level. This is called as glucose tolerance. To test this, we have oral glucose tolerance test. So how we do this test means by measuring the glucose serially before and after a specific amount of glucose given. So this is called as glucose tolerance test. Regarding this glucose tolerance test, you should know four things. First is indications, second contraindications, third how you will do this test, and finally after the test how to interpret the results. So these are the four headings under which I will be discussing about oral glucose tolerance test. First, let me start with indications. The main purpose of glucose tolerance test is to diagnose diabetes mellitus. Normally, for diagnosing diabetes mellitus, we can also use fasting and postprandial blood sugar. The normal fasting blood sugar is 70 to 100 milligram per deciliter. When it crosses more than 126 milligram per deciliter, we can call it as diabetic mellitus. Whereas for postprandial blood sugar, the normal level is less than 140 milligram per deciliter. If it crosses more than 200 milligram per deciliter, then we can brand the patient as diabetic. Okay, so this is the cutoff and this is the usage of fasting and postprandial blood sugar. But there is a small disadvantage with this. Both this fasting and postprandial levels, they will tell you the glucose level at that particular instant, and it can be affected by various activities like food, medicines we take, sleep, stress, and also many other things can affect this both fasting and postprandial blood sugar. Mainly the recent activities can affect it. Okay, so because of this we can get both false positive as well as false negative result also. False positive means sometimes the patient will not have any characteristic symptoms of diabetes mellitus. For some other purpose, as a random investigation, he might have checked his blood sugar and that turned out to be an elevated value. Okay, so this can be also due to false positive thing. Okay, so this is called as false positive thing. Next, false negative. Sometime the patient will be having all the classical symptoms of diabetes mellitus like polydipsia, polyuria, polyphagia, weight loss, all those things he will be having. Or sometimes he may be also having the typical symptoms of complications. Okay, diabetic complication symptoms like diabetic nephropathy, neuropathy, or retinopathy. All these symptoms he will be having, characteristic symptoms he may be having. But still the patient blood glucose level, fasting and postprandial may be within the normal levels. Okay, this is false negative. So in these conditions, to confirm or to rule out diabetes mellitus, we can go for glucose tolerance test, which is the more standardized procedure than compared to our routine fasting and postprandial blood sugar. Nowadays, instead of GTT, we also have an alternate thing. In all these conditions, we can also use an alternate or more effective, more accurate marker, which is nothing but glycated hemoglobin, or otherwise called as HbA1c. So, but what is the problem with this HbA1c means? This HbA1c is slightly costlier, and also its levels will be highly fluctuating when the patient is having hemoglobin related disorders. Okay, especially in pregnant women, for diagnosing gestational diabetes mellitus, this GTT is the only option, because we cannot use HbA1c because the hemoglobin levels will be highly fluctuating during the course of pregnancy. Okay, so though it can be used as an option in the above indications, it is actually used mainly for diagnosing gestational diabetes mellitus. In addition to this, it can also be used for ruling out for the differential diagnosis of glycosuria. Glycosuria means the excretion of glucose in urine. So this can happen due to not only in diabetes, apart from that it can also happen in renal glycosuria, alimentary glycosuria, etc. So in order to differentiate these conditions, we can also go for the glucose tolerance test. So these are the various indications where you will do glucose tolerance test or OGTT. But among these causes, currently the most commonly used indication is gestational diabetes mellitus. Only during pregnancy we are going for GTT. Okay, in other conditions, if you want to confirm or rule out diabetes mellitus, we can go for HbA1c, which is actually an accurate marker, and it will tell you about the average blood glucose value for the past 2 to 3 months. Okay, so that's it about the indications for oral glucose tolerance test. Next, coming to contraindications. Just now I said that GTT can be used for diagnosing diabetes mellitus. But once you have diagnosed that, never ever use GTT for that patients. Okay, why means after knowing he is a diabetic, it is not advisable to give such a high dose of glucose to a diabetic patient. That's the reason we are not using it for monitoring. Okay, for if you want to monitor or if you want to check whether the your drugs are working properly or not, better go for FBS, PPBS, or you can go for HbA1c. Okay, so never do GTT for monitoring the disease. Okay, it is used only for diagnosing, and it should never be used in a non-diabetic person. Second thing, it should not also be done in persons who are extremely ill. Okay, the sick and bedridden patients, you should not apply GTT. You should not use GTT. Why means in these patients, the hormone levels, especially the counter-regulatory hormones like steroids and epinephrine, they will be highly altered, which in turn can affect the glucose tolerance levels. Okay, so that's the reason it should not be done in them. Apart from that, it is also contraindicated in patients with malabsorption syndrome. Okay, so malabsorption means if the glucose you are supplementing orally cannot be absorbed properly. Okay, if it is not absorbed properly, it cannot assess the glucose tolerance properly. Okay, so that's the reason in these conditions we should never go for GTT. We should go for the alternate methods for measuring the blood glucose level or for diagnosing diabetes mellitus. So that's it about the indications and contraindications. Next, coming to procedure. So suppose if you are planning to GTT for a person on Monday, your procedure or preparations should start almost 3 days before the day of the test. Suppose if you are planning on Monday, means you should start preparing the patient from Friday onwards. So from Friday onwards, that means Friday, Saturday and Sunday, these 3 days, you should not take any medicines which can affect the blood glucose level like steroids, OC pills, thiazide diuretics. All these things can affect the blood glucose level. So all these drugs should be stopped 3 days prior to the day of the test. In addition to this past 3 days, the patient should be taking unrestricted carbohydrate diet. Unrestricted means minimum his diet should have more than 150 grams of carbohydrates per day. Okay, so you should be taking unrestricted carbohydrate diet for the past 3 days. Next, a day before the test, that means on Sunday night, if you are planning on Monday, on Sunday night he should complete his dinner by 8 p.m. and he should be start his fasting. Okay, so then only minimum 10 to 12 hours of fasting will be there when you go for the test on the next day. Okay, so now with these preparations he will be coming to the lab on the day of the test. So when he comes, the first thing you should remember is the GTT should be done always between 8 a.m. to 9 a.m. It means due to the circadian rhythm, the hormone levels and the glucose tolerance can also be affected. That is why it is preferably it should be done between 7 a.m. to 9 a.m. Okay, so in the early morning it should be done. Okay, so when a patient comes to you at this time, first of all you should confirm whether he is in fasting or not. Minimum 10 to 12 hours of fasting is mandatory before proceeding with GTT. Okay, so after confirming that he is fasting for 10 to 12 hours, take his both blood and urine samples. Okay, and mark it as 0 hour or fasting sample. Both blood and urine should be taken. After that, give him glucose. Oral glucose should be given. So when you give the glucose, you should remember 4 things. First thing is dose. Second, which form. Third, how it should be given. And fourth is how at what rate it should be given. Okay, so first, what is the dose we should give means it is 75 grams of glucose. Suppose if it is a pediatric patient, then you can calculate using this formula 1.75 grams per kilogram of body weight. Okay, so 1.75 gram of glucose you should give for every kilogram of body weight. Okay, so but it should not cross 75 grams. So this is the dose we should give. Next, form. The glucose should be always anhydrous form. Okay, but the commercially available one like Glucon-D, Glucovita, all these things, they all are monohydrated forms. Suppose if you don't have any anhydrous glucose, you have only this commercially available ones, means what you can do is you can add 10% extra to compensate for the volume of water volume. Okay, so instead of 75 gram, you should give 75 plus 7.5, 82.5 grams if only you have the commercial one, which is a monohydrate form. If you have only that, you can go for 82.5 grams. Okay, so how this should be given means dissolve it in 300 ml of water. Okay, so measure the glucose, then dissolve it in 300 ml of water, and that should be taken slowly over 5 minutes. This is how glucose has to be given to the patient. After giving the glucose, start taking both blood and urine sample every half an hour for the next 2.5 hours. Okay, so which means totally we will be taking 6 samples. So first is 0 hour or fasting, half an hour, 1 hour, 1.5 hour, 2 hours and 2.5 hours. So totally we'll be taking 6 samples will be taken. Okay, so when you collect these 6 samples during this 2.5 hours waiting period, you should also remember a few more things. The first thing is the patient should be made to sit in a comfortable position without any anxiety, without doing much physical activity, and he should never be allowed to take coffee or smoking, because all these things can affect the glucose levels and glucose tolerance levels. Okay, so keep all these things in mind and then take sample every half an hour for the next 2.5 hours. So now we have taken 6 different samples, blood sample and urine sample. Okay, so we'll be processing it and we'll be estimating the glucose levels in both blood and urine. Okay, so now with these 6 values, how to diagnose? Okay, so how to interpret the GTT results, I will explain you now. So with these 6 levels, you can easily plot the graph with x-axis, time in x-axis, and plasma glucose level in the y-axis. Okay, so for a normal person, how the values will be means the fasting level, usually the fasting level or the 0 hour level, it will be less than 100 milligram per deciliter. Normally during 0 hour or fasting, it should be less than 100 milligram per deciliter. Okay, then after glucose is given, slowly the blood glucose levels will rise and they will reach the peak at the end of 1 hour. Okay, after 1 hour, by the action of insulin, the glucose level will start reducing and they will reach the almost the fasting level by the end of 2 hours. Okay, so you should ideally should at least come less than 140 milligram per deciliter. Okay, so ideally should go to pre-fasting level, but at least it should be less than 140 milligram per deciliter. Okay, so this is how the GTT curve for a normal person will look like. Okay, so this is about the blood sugar. Next, coming to the urine sugar, the normal renal threshold for glucose is 180 milligram per deciliter. As none of the blood glucose levels are crossed this 180 milligram per deciliter in a normal person, the urine sugar will be negative throughout the test. Okay, so this is how you can identify a normal person with his GTT values. Okay, so to confirm that it is normal GTT, that the person is not having diabetic or any other deformities, to confirm that he is a normal, he should satisfy 4 criteria. What are those 4 criteria means? First thing is the fasting level should be less than 100 milligram per deciliter. Second, 2 hour value should be less than 140 milligram per deciliter. Third, none of the values should have crossed 180 milligram per deciliter. And finally, because of this, none of the urine samples should be positive. Okay, all the urine samples should be negative. Okay, so if it satisfies all these 4 criteria, only then you can declare the patient as a normal person. Got it? Fine. Next, we will move on to diabetic chart. Okay, so how to diagnose diabetic person. So in a diabetic person, how the graph will be means the fasting level, it will be more than 126 milligram per deciliter, or the 2 hour level will be more than 200 milligram per deciliter. If any one of this is satisfying, then you can brand the patient as diabetic patient, diabetes mellitus. Okay, either the fasting should be more than 126 milligram per deciliter, or 2 hour value will be more than 200 milligram per deciliter. Okay, if any one is there, then you can brand them as diabetic. Okay, so urine samples, it depends. Okay, so as whenever the blood glucose is crossing the renal threshold, that means 180 milligram, the corresponding urine samples will be positive. Okay, so this is how it will be there in a diabetic mellitus patient. Sometimes you will get a graph in between normal and diabetic, that is called as pre-diabetes. So here the fasting blood glucose will be between 100 to 125. Okay, so normally in a normal person it will be less than 100. In diabetic it will be more than 126. So in a pre-diabetic patient it will be between this 100 and 125. Coming to the postprandial blood sugar, 2 hours after glucose. Okay, so not postprandial, it is 2 hours after glucose load. So how it will be means normally it should be less than 140. If it is more than 200, we call that as diabetic. It will be between this 140 to 199 value. Okay, so this is how GTT graph can be used for diagnosing diabetes mellitus and also pre-diabetes. Okay, but whatever we have seen so far is called as conventional GTT. Nowadays, we are not following this. Not following this means we are not measuring 6 different samples. Okay, we are not taking 6 samples. Okay, instead we are taking only 2 samples. Okay, that is called as modified GTT. So which is the one we are currently using nowadays. Okay, so here what we do is everything is same, procedure is same, preparation is same, precaution is same, everything is same. The only difference is there in conventional GTT we'll be taking 6 samples, but here we'll be taking only 2 samples. What are those 2 samples means? One is fasting and the other one is 2-hour sample. Okay, so if the fasting sample is more than 126 milligram per deciliter, or 2-hour value is more than 200 milligram per deciliter, then you can name the patient as diabetic patient. He can be diagnosed as diabetes mellitus. Okay, if the fasting is between 100 to 125 and postprandial is between 140 to 199, then you can say it as pre-diabetes. If the fasting is less than 100 and 2 hours is less than 140, he is a normal person. This is how modified GTT is used currently for diagnosing the diabetes mellitus. Okay, so this cutoff you should not forget it. Okay, so nowadays we are taking only 2 values. One is fasting and the other one is 2-hour value. Even urine sugars are also not used. We know that urine sugar nowadays it cannot detect, because urine sugar we use Benedict's test. Okay, which is not specific for glucose. It can be answered by any reducing sugars. Okay, so urine sugar is also not done nowadays. We are using only blood glucose, fasting level and 2-hour level, but all the procedures are same. But if it reaches the cutoff, then we say normal. If it is above the cutoff, we say it as diabetic mellitus. Okay, fine. Next, apart from diabetes mellitus, GTT can also be used for diagnosing, for the differential diagnosis of glycosuria, I said. So glycosuria, it can be of 2 types, renal glycosuria and alimentary glycosuria. So what I mean by renal glycosuria means, I said that the renal threshold for glucose is 180 milligram per deciliter. But sometimes in some patients, this renal threshold may decrease. It may come to 120 or 130 or 140. In such conditions, what will happen means, even with a normal blood sugar level, urine sugar will be positive. Urine will be glucose will be excreted in urine. Okay, so blood sugar is normal, but urine sugar is positive means then we can make the diagnosis as renal glycosuria. This is normally seen in pregnancy, but pathologically it can also be seen in Fanconi syndrome, a condition where the S-GLUT, okay, sodium dependent glucose transporter 2, which is responsible for the renal reabsorption of glucose, will be defective. Okay, so that condition you can go for, it can lead to renal glycosuria. Next, coming to alimentary glycosuria, here the name itself says the problem is with the alimentary canal or the GI tract. So in some patients, especially the patients who have gone for gastrectomy and also in hyperthyroidism patient, what will happen means the absorption of the absorption of the dietary glucose will be so fast, it will be very rapid. So because of this fast clearing, what will happen means the 1-hour blood sugar value will reach the peak and it can cross more than 180 milligram per deciliter also. Only the 1-hour value, it will cross the renal threshold. So exactly at that point, the urine sugar will be positive. Whereas at the other levels, okay, half an hour, 1.5 hour, 2.5 hour, in all these time, blood sugar will also be normal and urine sugar also will be negative. But only at 1 hour, if the blood sugar glucose crosses 180 and urine sugar is positive, then that condition is called as alimentary glycosuria. Okay, so that's it about the GTT, usage of GTT in a normal person. But GTT, I said we mainly nowadays we use mainly for diagnosing gestational diabetes in pregnant women. Okay, so there how it is used. Okay, so there is a slight modification in the method how we do it and how we interpret it. Okay, so there is a mild deviation from the normal GTT. So what is that deviation and how we are doing this GTT in pregnancy? I will be discussing now. So normally when you can do GTT in a pregnant woman means the ideal time is between 24 to 28 weeks, because only during this time the insulin resistance will increase and the person will exhibit hyperglycemia. Okay, so it is better to do between 24 to 28 weeks if you want to diagnose gestational diabetes mellitus. So at that point of time, when a person comes to you, when a pregnant woman comes to you, you can do GTT by two different approaches. One is single step approach and the other one is double step approach. First, let me discuss about the double step approach. So in this double step approach, first what you should do means when a person comes to you, when a patient comes to you, first you should do a screening test which is otherwise called as glucose challenge test. So here what we will do means, irrespective of any preparation or fasting, nothing, whenever she comes to you for the first time, what you can give is, you can give her a 50 grams of glucose load. Okay, you no need to see whether she is in fasting, whether she stopped medicines, or whether she is taking unrestricted carbohydrate diet. No preparations are needed. Okay, when she comes to you, just give her a 50 grams of oral glucose. After giving that, wait for 1 hour. Exactly after 1 hour, you measure the blood glucose level. After 1 hour, if the blood glucose level is less than 140 milligram per deciliter, you can easily rule out gestational diabetes mellitus. Suppose if it crosses 140 milligram per deciliter, you have to perform the normal GTT with 100 grams of glucose. Okay, so if it is after give 50 glucose challenge test is very simple. Okay, give 50 grams of glucose. After 1 hour, measure the blood glucose. If it is less than 140 means rule out GDM and send her home. Okay, suppose if it is more than 140 means tell her to come on the next day to perform the routine GTT with 100 grams of glucose. Okay, so when you perform this GTT 100 grams, so the cutoff alone is different. All the procedure and preparations are same like the normal GTT, but here the cutoff varies. The fasting level should be less than 95 milligram per deciliter. 1 hour should be less than 180 milligram per deciliter. 2 hours should be less than 155 milligram per deciliter, and 3 hour value should be less than 140 milligram per deciliter. Okay, if any two values crosses this cutoff, then you can diagnose as gestational diabetes mellitus. This is called as two-way approach of glucose tolerance test in pregnant women. Okay, so first is glucose challenge test. With that, we can rule out GDM. Okay, so few people you can send home. For the remaining people for whom the blood glucose is more than 140 milligram per deciliter, go for routine GTT. Okay, with 100 gram. If any two values crosses this cutoff, then diagnose them as gestational diabetes mellitus. Okay, so this is two-step approach. Coming to the one-step approach, it is same like the routine GTT. Okay, so do the preparation, everything you do, give 75 grams of glucose, take fasting and 2-hour value. Okay, take fasting 1 hour and 2-hour value. So if any one of the value crosses this cutoff, okay, if fasting is more than 92, or 1 hour is more than 180, or 2 hours is more than 153, you can brand them as gestational diabetes mellitus. Okay, so this is the single step approach. Okay, single step approach is same like the conventional DTT. Only thing is the cutoff values are different. Okay, if fasting is more than 92, or 1 hour more than 180, or 2 hour more than 153, we can diagnose as gestational diabetes mellitus. Okay, so that's it about glucose tolerance test. Okay, so glucose tolerance test, it can be used for diagnosing gestational diabetes mainly. Okay, nowadays we use mainly for GDM, but it can also be used for diagnosing normal diabetes and also for differential diagnosis of renal glycosuria. Thank you.